My name is Sadaf, and today I'm going to be talking about two nursing theorists, Patricia Benner and Hildegard Peplau. I will also be discussing their theories in relation to nursing and nursing practice. First, let's talk about Patricia Benner and the novice to expert model. Patricia was born in 1942 in Hampton, Virginia. She received her bachelor's of nursing in 1964 at Pasadena College and her master's and doctorate degree at the University of California. Patricia worked on multiple med-surg and CCU floors, and after receiving her PhD, she began teaching at the University of California. She's written multiple books and published many articles. One of her most notable works was introducing the novice to expert theory in 1984. Benner understood that increasing levels of acuity and decreasing hospital stays called for more experienced and competent nurses. Benner used the Dreyfus model of skill acquisition to develop her novice to expert theory in clinical nursing. Benner explains that a nurse passes through 5 levels of proficiency: novice, advanced beginner, competent, proficient, and expert. According to Benner, each level builds upon the previous one and moves from relying on abstract rules to using concrete experiences. Let's explore each level a bit further. The first step is the novice. The novice nurse has no previous experiences or critical thinking skills. The novice uses a set of rules and principles to guide practice. The nurse's goals are measurable, such as taking vitals or measuring intake and output. During the advanced beginner stage, the nurse has enough experience to govern practice, but isn't completely free from the use of rules and guidelines. The nurse's readiness to learn in this step depends on his or her previous experiences with similar situations. The nurse at this stage hasn't fully learned the importance of prioritizing yet. During the third stage of novice to expert model, the nurse begins to see his or her actions as long-term goals. The nurse is organized and begins her day as setting a plan and is conscious about these plans throughout the day. The nurse in this stage has enough experience to be able to handle and troubleshoot unforeseen situations that may arise in the clinical setting. The nurse in the proficient stage begins to see the bigger picture. Every decision that's made is based on the nurse's previous experiences, and decision-making is done in a holistic manner. The patient is seen as a whole and not just as a combination of signs and symptoms. The last stage is the expert stage. At this stage, the nurse no longer uses rules or guidelines to understand clinical situations, but uses experiences and intuition to make decisions. The one thing that sets the expert nurse apart is the ability to imagine what's next or what is possible. The nurse at this stage is able to understand that every situation is different, but can use previous experiences to make sound clinical judgments. A study done by Ashbandi and colleagues found that Benner's novice to expert model can be used not only in nursing practice, but also in education, research, and even management. Next, we move on to the second theorist, Hildegard Peplau, and the theory of interpersonal relations. Peplau was born in 1909. She received her PhD in 1947, and she was the first published nurse theorist since Florence Nightingale. She served as a mental health nurse in the Army and has published many articles and books in her career. Peplau published the theory of interpersonal relations in 1952. The basis of this theory was focusing on the relationship between the nurse and the patient and guiding the patient to move from depending on the nurse to becoming independent. Peplau also reinforced the idea that in order for the nurse to be able to help the patient identify their goals and problems, the nurse must come to terms and understand her behavior and how this impacts her stance on health. The 4 steps of Peplau's interpersonal relations theory is orientation, identification, exploitation, and resolution. During the orientation phase, the nurse and the patient are strangers. The nurse's role is to assess the patient and to come to understand the patient's problems and expectations. During the identification phase, the nurse and the patient work collectively to develop a care plan based on the patient's goals and expectations. During the third stage, or the exploitation phase, the patient begins to feel like they are an important part of their care. In this phase, the care plan that was developed in the previous stage takes effect and actions are taken to meet the goal of the patient. During the resolution phase, the termination of the professional relationship between the nurse and the patient occur. Here, the nurse and the patient decide whether or not the goals were met. Peplau also explains that each nurse has 6 main roles in healthcare. The roles are stranger, teacher, resource person, counselor, surrogate, and leader. Think back on your own nursing practice. How many of these roles do you take on in your everyday work? Now that we know a little bit about Benner and Peplau, let's discuss how we can use their theories in practice. For my case scenario, please refer to my academic paper.